Welcome back, everyone, to the 7th MyPSA National Pharmacy Debate Competition 2021. We hope you're enjoying it so far. We have had three exciting debate sessions so far. Now, we will be continuing it with the next three for today. The question is, are you guys ready to witness it?
I don't know about you, Kelvin, but my heart is pumping with adrenaline for the next three sessions. It is going to be consecutive, like non-stop excitement. I can't wait to see what unravels.
I'm with you on that, Fiona. And I believe we have received our motion approximately an hour ago when the lunch break started. Now let's see what the participants are going to be debating about for the next session, shall we?
It seems to me that this House will legalize all drugs. Now, without further ado, we will proceed on with the debate sessions. Ladies and gentlemen, we hope you enjoy the debate session.
Thank you.
Hello everyone, ladies and gentlemen, good morning. Good evening. I'm pleased to welcome you to the first day of 7th MyPSA NPDC 2021. This debate will come to order. Representing the government side is team UKM and the Prime Minister. Hold on. Prime Minister of Government, Teo Yi Ying, DPM T Hung Piao, and Government Whip Ainur Amira. And we have here representing opposition team is AIMS team, the LO Devasri, DLO Goy Shuwei, and Op Whip Roshini. It will be my responsibility as moderator to remind a couple of things that each debater must have in mind. Number one, sensitive issues that would be offensive to political, religious, or ethnicities are prohibited. Number two, each debater has an allocated speech time of 5 minutes. The bell will be rung for the first time at the first minute, and for the second time at the fourth minute to indicate no longer POIs from the opposing side. Once 5 minutes has been reached, the bell will be rung twice to indicate that the allocated speech time has come to an end. Number three, the allocated time for a reply speech is 3 minutes with no POIs from the opposing side. With that, I'd like to invite Prime Minister to open up the case for the motion. What the motion is again? For this house would legalize all drugs. Is this true? Yeah. Okay. Here, Prime Minister.
My test, am I audible?
Yeah.
Good afternoon to everyone. I'm Yi Ying, the Prime Minister from the government team. Our motion today is this house would legalize all drugs. Before I put forward my case today, allow me to define today's motion. Legalize means make something that was previously illegal, permissible by law, which means to make it legal. But making it legal not necessarily means making it legal to be taken to be consumed by everyone, but it is made legal for medical use and research purposes. And all drugs means a medicine or substance which has psychology effect when ingested or otherwise introduced into the body. So today, I, as the first speaker of the government team, strongly believe with the motion that this house would legalize all drugs. Before I present my argument, let me explain a little bit on the mechanism. By legalizing all drugs, we will propose strict and intensive research carried out before legalizing the drugs. And the drugs should be used professionally in the medical field, not to every citizen. And by legalizing it, does not necessarily allow for public consumption until it is fully safe and well researched. And it does not mean that we are loosening the regulations or law. We are very strict on that. And it is only for medical use and research purposes with strict regulations. Also, when we come out with legalizing all drugs, we will also include education campaigns to educate the public about how are we going to legalize and what the rules and regulations about the drugs. So now a little bit about the status quo. In Malaysia, there are many drugs are banned due to high abuse potential. For example, cannabis, which is also known as marijuana, and it is a psychoactive drug. In Malaysia, it is illegal. But I would propose that we should legalize it, but with strict laws, because it will open up to research rooms. You can see that we have sophisticated systems to regulate and control the drugs to be used, and for research to find out more potential in the drugs. The research being done with this previously banned drugs are done 50 years ago, but now we have the advance of technology. We believe that we are capable. I'm sorry, let me finish first. We are capable to extract benefits from the drugs. So this comes to my first point. But we propose to legalize all drugs because we are using it research for potential drug usage. With our technology, which is improving, we believe that it will benefit to a whole country. For example, marijuana. In British, the British Medical Association has lent its support to calls for further research and legal sales of drugs derived from cannabis, because it is proof that cannabinoid medicine can be used for treatment in multiple sclerosis, which is a disease of the brain and the spinal cord. So, to ban and prohibit the drugs, it will be ruling out possible cures to disease, like how cannabis can be used for treatment of depression and anxiety, or even multiple sclerosis. I think the opposition team might be wondering about the potential abuse of drugs, but all these can be catered with the innovation. For example, cough drops, they have high rates of abuse, but research has been done to make cough drops decrease abuse. For instance, we add substance in cough drops that might cause the cough drops to be very unfavorable when consumed in large amount. Therefore, we hinders it. When we do research in the drugs, we extract the benefits from them, the benefits of the drugs, the therapeutic effects, which will benefit all, to the whole nation, even to the world and all human. So once again, before I end my speech, I would like to stress that all drugs can be legalized to be used by professionals for medical and research purpose. With that, I'll stand our motion today. Thank you.
Here, thank you, Prime Minister. Now let's invite LO from East. Here.
Am I audible?
Yes.
Very good afternoon to the Honorable Moderator, Precise Timekeeper, Vice Adjudicator, respected government team, and my loyal teammates and member of the floor. I would like to oppose today's motion, which is this House will legalize all drugs. I repeat, this House will legalize all drugs. We as the opposition team believe that this motion must fall. I repeat, this motion must fall. Before I tell you why, allow me to redefine today's motion in phrases. I would like to bring to your attention to these phrases where the opponent has misinterpreted. The term legalization, according to the Cambridge Dictionary, is legalization carries a meaning that allows something by law, and after legalization, the public and other parties have no authority to go against the law. And all drugs are the substances used in the diagnosis, treatment, or prevention of any disease, or has a component of a medication, such as substances as recognized or defined by the U.S. Food, Drug and Act as well. To make it clear, this motion goes for all drugs and should not only emphasize on medically used drugs. Before moving on with this debate, I, Devashree, the leader of the opposition team, will be addressing the negative impact from an individual perspective, while my deputy opposition leader will deliver arguments from negative impacts for society and economic perspective, and my opposition view will be rebutting the points from the government team and summarize the case for today. I will continue my case in a while, but before that, there are some points from the Prime Minister of the government team that need to be addressed. First of all, I would like to tell you that how wrong the first statement was given by the government, and it's very unprofessional to begin a debate with untrue claims. She was claiming that she will legalize all cannabis with restricted rules. This is irrelevant point. Once you are legalizing, then it means once you are legalizing, can someone restrict the public to not use them? Once you are legalizing all drugs, you are telling the public it is official to consume all drugs without any restrictions. Let me come to my first argument. Why we are opposing this motion is emphasizing on legalizing all drugs. More people will take if they are legal. Free availability of drugs once they are legal will make it far easier for individuals to buy and use them. Can I ask the Prime Minister of the government team, will you allow your friends to buy cannabis and use them in front of you? I'm sure she will not. This must at least partly have to do with the illegality. Indeed, in Australia's survey, 29% of those who had never used cannabis cited the illegality of the substances as their reason for never using the drug, while 19% of the who has ceased use of cannabis cited its illegality as their reason. Coming to my second argument, if we legalized all the drugs, there are high chances for an individual to misuse the drugs. Legalization in making the public allowed to do whatever, also get the drugs whenever they want. In that case, the opioid epidemic began in the late 1990s, particularly with the birth of Purdue Pharma Oxycontin in 1996. But it was until 2014 that the Drug Enforcement Administration rescheduled some opioid painkillers to put harsher restriction on them. It took until 2016 for Congress to pass a law that attempted to seriously address the epidemic. In fact, the federal government pushed the doctors to prescribe opioid through the Pain Has the Fifth Vital Sign campaign in the 1990s and 2000, as the drugs companies misleadingly marketed opioids to treat chronic pain. As a result, a lot of people have died. This is what the government wanted. In terms of overdoses, the opioid epidemic is deadly than any other drug crisis in US history. In total, more than 560,000 people in the US died from the drug overdoses between 1999 and 2015. Not only that, here you go. Have another proof where Colorado, which legalized the seemingly benign drug marijuana, marijuana-related traffic deaths increased by 48% in 2013, and by 2015, it has doubled by 21%. From that, the points of arguments which were proven clearly with statistical evidences, it is very apparent that legalizing all drugs causes many drawbacks, as I've mentioned just now. Hence, we, the opposition team, believe that it is important for this House to oppose today's motion. Therefore, today's motion must fall. I repeat, it must fall. And we will continue to tell all the reasons until the debate ends. With that, I rest my case. Thank you, ladies and gentlemen.
Thank you, LO, for that speech. Let's move on to DPM. Here.
Hello everyone, can you guys, oh my god, I think my virtual background is, I think, can I not use the virtual background? Okay, oh. Okay, am I audible?
Yes.
Okay. Starting in 3, 2, 1. Good morning, ladies and gentlemen. Today the topic is this how to legalize all drugs, and we believe that this motion should stand. But we have set a few parameters that the opposition has failed to acknowledge. First, before beginning on my arguments today, I would like to do some rebuttals on the points that is given by the opposition team. First of all, they said that we are going to mention only medical use drugs. We want to legalize only medical drugs, and that is not the case, ladies and gentlemen. In our case, in our narrative today, we want to legalize all drugs, especially for the use of research and medical use, not especially exclusively for the use of research and medical use. So what is the status quo right now? So many drugs are being banned from the research of science and pharmaceutical uses, just because we think that it's going to be having a high abuse rate, or we ban them from doing research. And this research has been banned for 50 years, ladies and gentlemen. 50 years. Many things could have changed. The technology has advanced so much. So why should we constrict ourselves and not letting a looser law to letting a strict law to be implemented for researchers to research on these drugs? That is what our government side Prime Minister has been emphasized on. We want these drugs to be accessible to researchers so that we can improve our healthcare system, ladies and gentlemen. We can we can improve more drugs in the future just because we have better technologies. For example, cough drops. Cough drops have a high abuse potential in the past, but we improvise the formulation of cough drops. Cough drops, when taken in large amount, would taste so bad right now, and this proves that we have statistics like 30% of cough drops addicts have been reduced just because we improved this formulation. With that being said, I believe technology advancement has led us today with better technology which could reduce the drug abuse while researching for a greater drug use as a cure in the future, such as for cancer. We don't want to lock ourselves in this box. And they say that more people would take and use the drugs. Ladies and gentlemen, this is not true in our mechanism today. We said that we would use these drugs for medical and research uses, not for recreational uses. We did not. Okay, sure.
Just now you said that you will be using all drugs for research purposes. But can I ask that will you allow the animal to suffer with unknown medication that you want to think of legalizing it?
Why animals? We are not talking about animals.
Because the research purpose, because the last point you have to test the medications on the animal. That's why.
Ladies and gentlemen, clearly you don't have an understanding in science. There are so many ways other than animal testing and other alternatives than research. Clinical trials can be done in so many ways, and our technology is getting more and more sophisticated each and every day. So moving on to my first point. My first point is we are going to reduce problems of social stigma and discrimination. Imagine a patient has to use a drug that has been banned in the past. Like just in Malaysia, we have banned marijuana. But just because the society has disapproved it and the government has banned it, these people has to face so many pressure from the society. They have a hard time finding a job, facing pressure from the peers, facing pressure from society. People discriminate against these people, thinking that these people are drug abusers, addicts, and no jobs, and they're uneducated and are useless just because the government the government has set up such laws against these people. Oh my God. Ladies and gentlemen, we can easily point fingers to these people, putting full blame on them just because you are not the one having these drugs right now. If you are having such conditions, do you want to be, nobody wants to be discriminated in such way. What's worse, this case has been taken to an unnecessary extent. For example, in Malaysia, a medically expert doctor has been hanged to death just because he's prescribed marijuana to patients that needed it. By legalizing it, we would remove this kind of discrimination and prevent the goodwill of doctors to prescribe these drugs. People will not be oppressed and bullied anymore and not be judged anymore. This house believes that government should not cause such discrimination in these people with medical problems. Next, we would open up drug markets in a regulated way. By opening up these drug markets, we could curb two problems. One, unauthorized sales of drugs in black markets. Two, we can increase the drug tourism in such countries. Like if we have more law enforcement and stiffer sanctions on these drugs in the future, we can when we legalize it, we have more control on this use of drugs in the future. So we would curb unsightly scenarios such as overdosing, and we could even control these problems. And reducing black market is going to generate more revenue for our country. According to the United States, the government has generated 17.5 billion of revenue each year just because they legalized marijuana. And these taxes could be used for drug education purposes and establishing a better healthcare system. Ladies and gentlemen, with that being said, I believe that this house would legalize all drugs under the condition of medical uses and research. Thank you so much.
Okay, thank you so much, DPM. So now we invite DLO.
Am I audible?
Yeah.
All right, so I'll start now. Good afternoon to the respected speaker, timekeeper, honorable judge, members of the government team, and members of the floor. As the deputy team of the opposition team, I would like to first rebut all the points that are given out by the second speaker of the government team and bring out two new arguments to the floor, which is be categorized into society and economics. The deputy prime minister keep on telling us that they are exclusively including the medical and research, but at the end of the day, they keep on going days and they're going to support that they are legalize all drug with all condition. At one point, they say like, they are just going to use it for medical purpose and research purpose. And at the end of the day, they say they are going to open up to the market. So isn't that confusing? And apart from that, the deputy prime minister from the government team has kept on pressure from the public due to, it says that it by discriminating the people that use cannabis, it might cause the public to feel pressure due to the not legalization going against the point. However, as a citizen or even a doctor, shouldn't we follow the laws? Are you telling me that one of us that commits suicide or commit crime who is against the law should remove the law should legalize crime because they are getting discriminated by the public? Are you right? So moving on to the first argument from my speech, I will first start with the society point of view. First and foremost, we can start to look at the closest view, which is the family point of view. As we know, our parents keep on educating us about not involving ourselves into activities that has a high probability associated with drugs, such as going to bars or mixing up with peers and drug addicts. It clearly shows that how the society is keeping the young ones and even the adults away from the drugs as much as they can. According to the survey that was done by Colorado, adult past month marijuana use increased 63% in 2-year average after Colorado legalized recreational marijuana compared with the 2-year average prior the legalization. So what would our country look like if all drugs were made legal and open to purchase by all individuals? The incredible increase in collaborative damage from the legalization of marijuana in Colorado could be a clue for all of us in Malaysia, right? If we legalize all drugs, especially the opioid drugs such as marijuana, as mentioned by our first speaker, it opens up more channels and accessibility for one to obtain medication, thus would drastically increase the number of addicts in this country, causing immeasurable financial burdens and unimaginable human devastation. If drug accessibility is leveled up due to our current knowledge how powerful peer pressure is, will the parents trust their kids, our future hope for our nation, to go to school to get their education because of peer pressure? Society is afraid to do the drugs because one of the portion prone to addiction does not experiment with drugs due to workplace drug tests or concern for being arrested and unable to secure good employment in the future. So the government team, if the drugs are legalized, the latter group will no longer see the downside to abuse formerly illegal drugs and soon become seriously addicted to one or more substances. Looking from the economic point of view, which is my second argument, due to the legalization of drugs, it can cause an overwhelming need of rehabilitation centers, which could be a huge effect to our economy, even without considering the human damage in terms of life loss and endless addiction issue. We all know that by Star Report, this year itself, the federal government has already spent more than 1.1 billion on treatment in rehabilitation centers. If we legalize all the drugs, which will be rejected, which will inevitably increase drug abuse and addicts, is the government going to put more billions of money into it? Isn't it better for us to let this motion fall, to use this money in improving the healthcare system, which is why we want to legalize all drugs, to bring the benefits to the healthcare system in Malaysia? And isn't it better for us to use that money in the healthcare system in Malaysia to improve it, such as implementing AI system into our healthcare system? With all the supportive evidence, arguments, and clarification against the misleading points that are given out by the government team, it has already proven that the members of the floor shall agree that today's motion shall fall. That's all from me. Thank you.
Here, thank you. Let's move on to the next speaker from government side. Here.
Am I audible? Can you guys hear me?
Yes.
Oh. Starting in 3, 2, 1. Salutations to all, blabbering about big things such as banning drugs and stuff, but could not even cater to problems such as smoking, alcohol, and tobacco, which are freely abused right now. That's our opposition belief. First of all, I would like to rebut the points given by the opposition and emphasize the points given by our team leads. Firstly, the Prime Minister mentioned about we legalizing only medical drugs, which are not true. We did not mention legalizing only medical drugs, but we mentioned that we legalize all drugs under medical and research circumstances. This shows that the leader of the opposition did not listen to the Prime Minister carefully. We strictly say that legalizing all drugs for professional Their points also mentions about the opioid epidemic and whatsoever. Again, we did not legalize the drugs for recreational use. You all can see that they are not engaging with our points. They keep on avoiding our points, saying that we legalize drugs to professionals. Instead, they keep on giving points such as, will you let your friends use drugs, when we didn't legalize it for recreational purpose. Next. Secondly, the second leader of opposition mentions that we are saying we going to open up to market for medicinal because when we did research, we know which drugs can cure the disease. We know which drugs can cure which disease. So when that happens, only we can open it to over-the-counter where sick people can buy the medicine using prescription. We clearly mentioned no legalizing for recreational purpose. I don't know which part the opposition teams cannot understand when we say not legalizing for recreational purpose. Therefore, I think all the points that given by the second leader of opposition, including parents' worries, job employment, economics, and all are not valid because again, not for recreational purpose. Thus, no engagement made by their side that can prove legalizing drugs for medicinal and professional use are not beneficial. We believe that this means that we won the case. Move on to the clashes that are given today, whether we care about the citizens' safety. The main reason our side is legalizing all the drugs to improve our drugs technology. By legalizing the drugs, we can improve our medical system. Doing further research purpose, we can cure more disease. Imagine we are banning all these drugs, even for medical purpose. We can't use cannabis and stuffs just because of our law now. But what if one of the drugs can actually help people, but there is no further research on that?
Yeah.
Moving on to the second clashes, legalizing or decriminalizing. We believe that on our side, there's no such thing as decriminalizing all the criminals because we believe that we stated clearly we will only legalize the drugs under certain circumstances which are medicinal and research purpose. Third clashes, whether we are profiting the country and undermining the black market or corrupting the country's economy. My second Prime Minister mentions that we are going to tax the drugs when there are further research. By taxing the drugs that are bought over the counter using the legal prescription given out by authorized pharmacies and doctors, we can gain money for the country and boost the economy rather than making the black market mixing all those illegal drugs without knowing the safety and let them gain more. By legalizing it for this purpose, our country can gain money to be used for healthcare purposes. Next, whether the drugs are now accessible for researchers and medical purpose. In our world, we are saying that all drugs are legalized for medicinal and research purpose, but they were banning all drugs for all people. We cannot improve our technology using their stand because they are banning all drugs and they didn't put under any circumstances. They are banning all drugs for all people. No one can use drugs. Whether legalizing drugs, next clashes, whether legalizing drugs will be exposing citizens to access of drugs, drug abuse, drug addiction, and loser laws like they say having your friends have drugs and parents' worries. As my Prime Minister has already mentioned, we are only legalizing drugs mainly to allow for research and study, so we are not ruling out any possible cures. Furthermore, we are not loosening any laws with regards to buying and selling of all these drugs. In fact, we only make it illegal for authorized doctors and pharmacists to sell these newly researched drugs. Therefore, I rest the case. Thank you.
All right, thank you, Government Whip. Let's go on to Opposition Whip. Here. Can you hear me? Hello? Hello, can you hear me?
Yes, we can.
Yes. Okay. Good evening, ladies and gentlemen, our adjudicators, loyal teammates, worthy opponents, and all members of the floor.
To begin with, as the opposition whip, I still stand behind my team in going against our motion for today, where the opposition team believes all drugs should not be legalized. I will continue our case in a minute, but before that, there are a few things about the government team's speech that need to be addressed. First and foremost, how ridiculous is it to mislead the debate by defining the word as legal, not consumed by everyone, only used for medical field and research purposes, and only fully researched drugs will be available for the application of the public. But when legalization, truly defined by the Cambridge Dictionary, is to allow something by law, and after legalization, public and other parties have no authority to go against the law, and drugs.
Right, please.
The Prime Minister rejected. Drugs, the Prime Minister was focusing on drugs with only medicinal value when it includes all drugs, hard and soft drugs. And also, ladies and gentlemen, drugs, as I mentioned, mentioned by the previous speaker, she mentioned that only newly researched drug will be used, and then for research purpose, drugs, yeah, I understand, but drugs defined as a medicine or other substances which has physiological effect when ingested or otherwise introduced into the body. So drugs has a very wide scope, and all drugs include but what they keep emphasizing is the cannabis, and cannabis. That's all I hear for the research purposes. But when drugs have a lot of medicinal values and they have a large scope to be used, our opponents also have failed to address the question we raised a moment ago, where they keep on saying drugs will be used for research purposes. But when our first speaker raised a question regarding animal cruelty for suffering, they keep saying they have more ways for clinical trials due to technological advancement and stuff, but they have no clear view and not enough proof was submitted. PI rejected. According to Humane Society International, animals used in experiments are commonly subjected to force feeding, food and water deprivation, the infliction of burns and other wounds to study the healing process. The US Department of Agriculture reported in January 2020 that research faculties used over 300,000 animals in activities involving pain in just 1 year. Also, loser law.
PI, please.
Better technology, PI rejected. Better technology for cough drips when they are taken in large amount. The technology has increased, so does the death rate of drug abuse. The technology has advanced, so does the death rate for drug abuse. When drugs are prescribed, the doctors have evaluated the need of the patient for the drug. Once legal, the doctors can give it freely without evaluating properly. So my dear government team, how sure are you that technology can be a solution for this case? Also, you say that, don't you think it would be, you said that you will regulate the drug market, you said it will be used for the research purposes, but then you said you will regulate the, which eventually will regulate the black market. Don't you think it will be available to the public somehow if the black market is already there? And also, how sure is the other world that education campaigns will work against curbing this problem and that it won't cause any drug overdoses for the public? And moving on to my, before I end my speech, allow me to summarize on why the motion for today shall fall and why all drugs should not be legalized. In the case where drugs are legalized, it will be available everywhere. Therefore, free availability will cost the drugs once they are legal. It will make very easy for the individuals of all ages to buy and use them, which leads me to my second point from my first speaker, which is misuse. So opioid epidemic in the late 1990s, pharmaceutical companies reassured the medicinal community that patients would not become addicted to opioid pain relievers and healthcare providers, which is a rebuttal point for the government whip that they say opioid epidemic occurred because opioid was legalized due to recreational purpose, but then it was legalized due to because it is a pain reliever and for healthcare providers began to prescribe them at greater rates. But what happened in the end? Opiate overdoses accounted for more than 42,000 deaths in 2016. Also, parents are in fear all the time, not being able to trust their kids because peer pressure might influence the usage of drugs. Last but not least, drug misuse will cause severe effect on country's economy due to rehabilitation centers. With all these reasons, ladies and gentlemen, I believe the motion for today shall favor our side. Thank you.
Thank you. So let's move on to reply speech from side opposition. Here.
Can you hear me?
Yes.
All right, I'll start now. Good afternoon, ladies and gentlemen. Welcome for the last time from today's opposition team. Now it's the time to wrap up our debate and introduce the best points that are given out by both sides in this debate. However, I would like to address the flaws of the government team here due to the limited time. Before the start of my summarization, I would like to first compare the best point given out by both sides with the emphasizing of today's motion's objective. The government has a good point with their argument about researching to make a drug better. However, the government team has to they oversee the disadvantages that are following up with the legalization. Today's motion objective is to give the full benefit to our healthcare system. I believe that both arguments have a good side and a bad side, but in fact, we as the opposition team have more points to successfully prove that we will achieve this objective, which is the betterment of healthcare with lesser disadvantages than the government team, which clearly supports today's motion's shall fall. The government team kept on neglecting the fact that by legalizing the drugs, it includes giving the access to the public rather than just medically and research use. I would like to ask this question to the government team. May I know that even when the government already made the law that we shall not take drugs right now, there are still countless people who are doing drugs, right? So what will the prescription do in this matter? They are still going to have access to the drugs despite any laws that the government put out with. There is a will. There is a way. With prescription, they still cannot opt for the medication and will still opt for the black market. So what is the difference with the government team? They come out accusing us by misleading the fact, but for a fact that they are the ones who has been misleading since the beginning with the definition of the motion of the day. The opposition team kept on giving statements and data to support today's motion, while the government team were relying on ifs and buts with zero factual data to back out with their claims. As mentioned by our first speaker, there will be a high possibility of an increase of drug abuse and drug addicts, while as mentioned by our second speaker, the future will be disrupted due to the failure of trust by the society and the economy fails due to the increase of rehabilitation centers and treatment of the drug addicts that are all overseen by the government team. Instead of legalizing all the drugs, the government should actually invest more in other healthcare systems, like I mentioned before, such as artificial intelligence. Therefore, due to our superiority in our support of our arguments, the opposition team stands and brings this debate home. I rest my case. Thank you very much and have a great day, ladies and gentlemen.
All right. Thank you. And last speech for today. Government's reply here.
Can you guys hear me? No? Can you guys hear me clearly?
Yeah, I can hear you.
Okay, thank you. Starting in 3, 2, 1. Good afternoon, ladies and gentlemen. Today, this motion is this House would legalize all kind of drugs. And today, I think the major clashes in this, the major disagreement we have in our today's debate is the defining part, because they say that we shouldn't use legalization in terms of, like we mentioned about medical and research purposes only. Ladies and gentlemen, do you even know law? Opposition team clearly does not know law. They think that legalizing something means that we bring things to the extreme. Legalizing driving means that we can crash cars everywhere on a highway because we legalize driving. We don't have regulations to regulate car driving at a high speed. So today they don't know about regulations. So I can't blame them. Maybe they don't know law. But we want to tell them that with legalization, there comes with regulation. And our regulation is using it on medication and research purposes. Ladies and gentlemen, with that being said, let's take a look at other ridiculous points that they has pointed out today. They told us that animal cruelty, but animal cruelty has nothing to do with today's topic, ladies and gentlemen, because regardless of drug legalization happens, drug animal testing still happens. So why are you bringing this up? I have no idea. Next, they talk about opioid epidemic. Opioid epidemic occurs because just because of unnecessary prescriptions by doctors, which has nothing to do again with the legalization of such drugs. And I don't understand why they keep bringing up these points, which is completely a waste of our time today. Sorry. And next, let's compare of today's points brought up by two sides. Let's take a look at the first point of the side opposition. They say that side government first. We say that we could reduce problems of social stigma and discrimination. We suggest because if you have the need, you have such medical needs to use these drugs, we are allowing you to use these drugs properly, not by other means. And when there is such necessity, we shouldn't discriminalize people and take the rights away from them. But look at their side. They say that if people take this kind of drugs, regardless of any condition, even in medical condition, it would expose citizens to drug abuse, drug dangers. Wow, ladies and gentlemen, discrimination to its finest quality. Everyone who takes drugs medically would kill other people, would rape other people. Good job, government, on discriminating everyone. Next, let's take a look on the next point of our side. We say that we could find potential drugs and treatments because these drugs has been banned 50 years previously in our country. We want to improve, to develop these kind of drugs. And they say they want to improve current medical system. And we clearly mentioned that if these drugs are introduced, we can collect taxes from these people who are using it. And we have the fund to do so, and it's more viable in this way. And they say they want to focus on current medical system improving. Where are the funds coming from? Our country is almost bankrupt, and you expect to improvise it with no funds and no viability? So let's take a look at the final point where they say many people will use drugs, which is completely false. And today, I believe with that being said, with all the clashes and definitions being clear, I believe that this House would legalize all drugs under the regulation of medical and research purposes. Thank you.
All right, thank you so much for the debate. Right. Okay, thank you.
I have a question. Will I be delivering the results in the feedback session, like the Zoom link provided, or do I not announce the results? Okay, I'll announce the results then. Okay, so just give me like 10 to 15 minutes and then I'll deliver the results.
There's a link, right, in the chat.
Okay.
Okay. Thank you to reply speaker from government side, ladies and gentlemen. That with that we have reached the end of the debate session. We hope you had an excellent time watching the great speakers, and we'd like to sincerely thank you for tuning in. However, participants are required to enter another room for the feedback and result. For the audience, the results will be announced soon, so stay tuned and thank you.
Welcome back, everyone. The last session was bewildering, to say the least. It was amazing to see how each debater translated their thoughts into impeccable sentences. I believe the next session is going to be as spectacular as the previous one. But before we proceed on to the next motion, let's talk a little about the previous session. Now, before we start, Fiona, just to remind you that we are being recorded, so don't say anything about marijuana, don't say anything about cocaine, and don't say anything about heroin. Actually, I'm just joking. We are allowed to say that. But, I can't imagine this motion being implemented in the near future. As much as I would like to stay in the grey line, all drugs sound a little overboard.
I get what you mean, Kelvin. I can't imagine someone overdosing on cocaine to stay high and then proceed to accidentally kill themselves. Can you imagine the rising crime cases?
Yes, I get you, but we can look from a different angle. Imagine if the crime rate is due to drugs being illegal instead of legal, because then they will do their shady business out of public view. Imagine it being normal, like it's an everyday thing, like brushing your teeth. Imagine taking marijuana every day. Like, I can't imagine that.
Well, yes, I think we are veering off course simply because we are no debaters.
Yes, you don't have to remind me that. Well, let's just proceed on to the next motion, shall we? All right, so for the next motion, okay, I have my info here with me. Okay, so ladies and gentlemen, the next motion, this House will support euthanasia. Ladies and gentlemen, we hope you enjoy the debate session. We'll proceed on with the debate session in a short moment. Thank you.
opposition side is UniKL. It will be my responsibility as moderator to remind a couple of things that each debater must has in mind. Number one, sensitive issues that would be offensive to political, religious, or ethnicities are prohibited. Number two, each debater has an allocated speech time of 5 minutes. The bell will be rung for the first time at first minute and for the second time at the fourth minute to indicate no longer POIs from the opposing side. Once 5 minutes has been reached, the bell will be rung twice to indicate that the allocated speech time has come to an end. Number three, the allocated time for reply speech is 3 minutes with no POIs from the opposing side. With that, I'd like to invite the Prime Minister to open up the case for the motion this House supports euthanasia. Hear, hear.
Can you hear my voice? You do?
Yep.
Yes.
Okay. Bismillahirrahmanirrahim. Assalamualaikum and a very good afternoon. I bid to Mr. Chair, Speaker, Honorable Adjudicator, Precise Timekeeper, Government, Opposition, and of course, members of the House. Following the motion for today, this House support euthanasia. Standing as the Prime Minister of the government side, we wholeheartedly agree with the stance that we support euthanasia to be done with the physician's clinical judgment. Should we have the patients or the families of the patient request consent and the patients are terminally ill. This is based on the European Association of Palliative Care Ethics Task Force statement that medicalized killing of a person, whether involuntary or non-voluntary, is murder. Euthanasia can only be voluntary, that is with the consent of the patient. And today, we from the government support euthanasia with consent, passive and voluntary for terminally ill patients. We have 3 reasons to believe in this basis, which are our 3 main points. For my first argument will be represented by myself under the key phrase, every human has the right to live. My second speaker will deliver another 2 points, and my third speaker is going to rebut all of the points coming from the side of opposition, and he will summarize our case. But before that, let me define our motion for today. We agree with the practice of intentionally ending life to relieve pain and suffering based on the conditions that we stated just now for terminally ill patient. Ladies and gentlemen, moving on to my first argument for today. Every human has the right to live. Many terminally ill patients who are in the final stages of their lives have requested doctors to aid them in exercising euthanasia. For terminally ill patients where the disease are incurable and their disease are most probably going to result in death, in countries that legalize euthanasia, such as Japan, United Kingdom, United States, the terminal patients want the right to assisted suicide because it is a means to endure their death without having to bear the unnecessary suffering and cost. If we have to choose, ladies and gentlemen, if we have to choose between either death or life full of suffering, and the patient choose the former, I believe that it is their right, and we should not oppose this. A national survey of physician-assisted and euthanasia in the United States stated that 80% of terminally ill patients have requested their physician to have their right for physician-assisted suicide and euthanasia. And I think this is why we think that terminally ill patients should be given the right to choose for their life. Last but not least, we, the government, believe it is important for this House to support this motion that this House support euthanasia based on the condition that we stated just now. Therefore, we support this motion. Thank you.
Here, thank you for PM. Let's move on to LO. Here.
Hello, am I audible?
Yes.
Thank you to Ms. Speaker, and very good evening to all members of the floor. For today's motion, we as opposition teams are fully disagree these motions because euthanasia violates human rights. Now, allow me to address the issue of the Prime Minister arguments. In the arguments where, first of all, the government didn't fail to specify who they want to apply this euthanasia. Yes, they mentioned it's terminal ill, but they didn't specify whether it should be the children or the adults, because you have to understand no parents should see their children die, because for children they need the consent of the parents. And how do you think the parents will feel when they have to decide their children's life? Because all they want to see is their children to grow and have a life with them. So the government should specify this the term of who they want to apply the euthanasia. Just is terminal ill, but who? Children or adults? Next, the government, the Prime Minister said every human's rights, they have every human's rights to live. However, I find this statement is contradictory to what they supposed to say, supposed to support, because euthanasia in definitions is to end their life, but their point is to give the rights to live. So it's actually contradict to what they actually want to support with their points. Moving on, the opposition teams agree with the definitions given by the governments. However, we want to add something. There is 4 types of euthanasia: passive euthanasia, active euthanasia, involuntary, and voluntary. So for passive, is when life-sustaining treatments are withstood. Active euthanasia is when someone uses little substance or force to end a patient's life, whether by the patient or somebody else. Voluntary is when the euthanasia is conducted with consent, and voluntary euthanasia is when the euthanasia is performed on a person who would be able to provide information consent, but does not, or either because they do not want to die or because they were not asked. Moving on. Allow me to address a few things in order to establish our case today. The reason we debating this motion is because it violates human rights, which will be explaining more in my arguments. And what opposition is trying to achieve is to show the euthanasia will lead to widespread backlash from the public, so other alternatives must be done. Therefore, the governments need to prove what is the problem with the status quo that government believe euthanasia should be supported. Moving on to my arguments, which is first advantage with the keyword lack of regulations. You see, the implement of euthanasia have a very lack regulations in current policy. So the question is, how does the current policy monitor the actions of the doctors who were entrusted with euthanasia? Because from the perspective, a medical perspective, euthanasia can be defined as the process by which a physician deliberately administered a lethal substance or performed an interventions to cause the death of the patient who has decision-making capacity at the patient's voluntary request, which is defined by World Medical Association in 2019. The case because there is a case from Detroit Free Press, Dr. Jack Kavakian have abused his power in euthanasia, as 60% of his patients are not even terminally ill, and 13 of them have also not complained of pain, yet he ended their life. So we can see here supporting these motions will give too much power on the doctors, according to the Journal of Biology in Medicine in 2019. In Oregon, one of the state-approved euthanasia have caused 70 of the patients cancer, in which all of them can be helped by chemotherapy. choose to aid in dying because depression. So are we going to let this happen in our country? If the patient depressed, we can help them by seeking the psychiatrist, not end their life. That's why specific regulation on managing euthanasia is extremely important to ensure no abuse in power. Therefore, we as the opposition reject the motions because euthanasia violates human rights. Thank you.
Thank you all for that speech. Let's move on to DPM here.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Honorable Speaker and Member of the House. I, as a Deputy Prime Minister, fully support our Prime Minister to agree these motions today. The House support euthanasia. Before I go further, let me please refute the argument from the leader of oppositions. Her first argument is the lack of regulations. So we, from the government, we realize our country not implement yet this action, euthanasia, but some of other developed countries already implement it. So we, from the government, want to follow the implementation that already conduct from the developed country. So this, what we want to discuss in this motion is we want to discuss this is this action actually can be implemented or not in this country. So we discuss on it because if this action is possible to implement in our country, so we can make a law and the regulations for it. So proceed to my first argument with the stance we support euthanasia. Okay.
How do you want to implement the regulation from their country to our country?
Okay, thank you. So we will look at their their law and how they conduct the implementations. So actually from the maybe we look the example of how they conduct and do the procedure SOP, standard operation standard. So we look on this. So we will try to implement it in our country. Okay, I proceed with my first argument, which is to empower the quality of life for patients. I proceed to my first argument, which is the quality of life for patients will decline and plague at the late stage terminal disease. As we know, the patients at the terminal ill disease have experience of organ failure and some their body system part already to fail to function properly as a normal person. So they are unable to do a normal task like other human beings. So member of the house, terminal ill patients need to undergo more medical treatment to make them survive, but we cannot cure the disease. So I give the house example. Renal failure patients need to do dialysis treatment for their whole life. And also the heart failure patients require external pacemaker, medication, and also transplant to survive. So, but to get the transplant treatment is difficult because the demand of the organ is high, but the number of donation, the organ is low. Member of the house, if we do not have euthanasia as an option, so we make the patient suffer the pain to get the treatment to survive. Therefore, it is important for us from the government to support this motion. Based on my argument, quality of life of patient would decline and plague at the late stage terminal disease. Proceed to my second argument, to avoid self-infliction suicide, because suicide is a traumatic experience to family members, because suicide is the act of taking life secretly and other people not ready for us to end life. We want to lower the suicide rate in the world. WHO state that 700,000 people die due to suicide every year. So this rate have a high possibility that terminal ill patient also included in this rate. So we from the government fully support this motion because we want to based on our argument to avoid self-infliction suicide on the basis of our stance we support euthanasia because to be done with a physician clinical judgment should we have the patient or their family request and consent and their family patients and terminal ill. That's all for me. Thank you.
Thank you to DPM for that speech. Let's move on to here.
Hello, can you guys hear and see me clearly?
I can hear you,
Can you guys see me clearly?
but I don't think I can see you.
I'm using two device. So one device is for my camera and one device is for my voice. So
Okay, I see you.
Okay, can you see me? Okay.
Yep.
Okay. Yeah, start. Thank you to Ms. Speaker and good evening to the members of the floor. Regarding this motion, which is this House Support Euthanasia, opposition team proudly opposed because euthanasia causes more harm than good. Now, allow me to address a lot of things coming from the government team. And you can see that starting from the Prime Minister to the Second Minister, we can see that the case is really flawed. Because why? Because they never show us what is the policy and regulation that they want to do if they want to apply euthanasia. And they also never stated what the criteria for patients that will receive euthanasia, who is involved in the decision-making process, and what are the criteria or requirements for the doctors that are involved in this process. Is it specialists? Is it normal doctors? Is it the nurses who will be involved in this process? You need to realize that this thing is a very, very intricate process. So you need to ensure that you have proper policy and regulation to ensure that this thing will be effective in a very, very proper way. So we as the opposition, so coming to the Second Minister on how he stated regarding that there are a lot of costs for medical treatments, issues for people. So if euthanasia is actually not applied, so you need to realize that actually basically from the flaw coming from his point is that this thing, the cost of the medical treatment, there are a lot of ways we can solve the cost for the treatment, medical treatment issues. First of all, we can see that the government have helped in incentive in also like financial support for people who are unable to pay their medical treatments. So by using this financial support from the government, they can actually pay for these expensive medical treatments. Thus, the arguments coming from the opposition, from the government team, especially the Second Minister, fails clearly. Now, moving on to my own points on the first. Thank you. Rejected. Thank you. Now, moving to my own first point under the key phrase of unnecessary pressure. You can see that actually euthanasia exposes vulnerable people, patients, and their family to pressure to end their life. We believe that euthanasia should not be allowed because it will be abused. You need to realize that the fear is that if euthanasia is allowed, vulnerable people will be put under pressure to end their life, which we believe it is not what we want. First, regarding the pressure from family and other members, you need to realize that maybe family will be regard them as a pressure and burden, which push pressure on them on the sick person, so that they want to ask for the euthanasia. As we can see that in increasing numbers of examples of abuse and neglect of elderly people by their families, which makes this an important issue that we need to consider clearly. Think, government. Besides, after their death, by euthanasia, family members will also be affected. Based on a study on Ontario Network, June 2017, after the death of the patients, 11% of family members in the medical assistance in dying group were depressed and 38% were receiving mental health care. So this is why we believe that even if euthanasia is actually executed, it will actually have more effect to the family members as well. And regarding, so that's why we believe that the patient health condition should be prioritized, as their welfare should be the main concern. Imagine if a patient is diagnosed with a colon cancer stage 3, which can be cured by surgery and chemotherapy, but due to the family pressure, they want to end his life. Is it actually fair? So before I proceed, I will accept one POI.
From me, or okay, from me. Okay, so okay, you stated that okay, there are believe there are effects of euthanasia towards the family members once the patient has died. Okay, so I would like to ask you, how about the psychological effects of what do you think on the effects of suicide comparing to euthanasia?
Thank you. I get the point, but we believe that actually euthanasia will have more psychological damage to the patients and the family as well. Now, moving on to my second point, which is the alternative that the opposition is trying to brief, is the palliative care. So palliative care is actually a specialized medical care for people living with a serious illness, in which the goal is to improve quality of life for both the patient and the family. And palliative care is provided by a specially trained team of doctors, nurses, and other specialists who work together with the patients to provide extra layer of support. It is based on the needs of the patients, not on the patient's prognosis, which is and it is actually good because it is appropriate for any age and any stage in serious illness, and it can be provided along with a curative treatment. Based on the Ministry of Health website, Ministry of Health actually have planned to eventually develop more specialized units of palliative care in all states hospitals in the country, especially in hospitals where they are increasing specialist service dealing with more complex and technical disease processes involving patients with life-threatening conditions. So that is why we believe that it is actually better than euthanasia, as it is harmful and not only for patients but also for the patient's care on the large scale. We believe that development for palliative care should be more improved by allocating more efforts in this care instead of euthanasia. So we believe that this motion should be opposed because euthanasia causes more harm than good. So we demand the government team to tell us what is the problem with current status quo that the government believes euthanasia should be supported. So that's why I'm proud to oppose. Thank you.
Here, thank you to DLO. Let's move on to government whip.
Okay, can everyone hear me clearly?
Yep.
Right? Okay. Okay, Assalamualaikum warahmatullahi wabarakatuh, and a very good evening, I bid to the Honorable Chairperson, Vice Educator, members of the opposition, my friends from the government, and of course, members of the House. So, I believe that even after the arguments given by the opposition, and of course through our eloquent elaboration on our case today, we believe that this motion, this House supports euthanasia, shall remain standing firm despite whatever the opposition has given today. So, what some of the problems that I feel. One of the problems that I feel that the opposition is facing right now in their arguments, that their first argument stated that it is violating human rights. They have failed to specify which human rights they are violating, in which in our first argument we have already stated that our right that we are trying to uphold is the right to live or right to life. What does it mean by the right to live or the right to life? It means that the right of the life of a person, the patient, should any decision made by the patient on their life decisions, it should be respected and should be implemented. And when they say that euthanasia is violating human rights, it is actually counterintuitive. They are being counterintuitive because should the patient, and also after intense clinical judgment made by the physicians, that after that the terminally ill patients have lesser quality of life, have a bad prognosis, and the patient knows that he or she will suffer, and we're denying the chance for a relief of pain or for relief of suffering. It's counterintuitive on saying that euthanasia is violating human rights. No, thank you. And also, they have stated that we have failed to specify who to apply euthanasia. So, from our definition, we have stated that should with the patient's consent. So, I would like to remind this House that who has the power of consent, which is adults. So I don't know why they are trying to bring in children into this debate, because obviously we do not want, of course, children cannot make decisions upon themselves, and of course any other family members would not want to see their children die. So I don't know why the opposition would like to bring this into this debate. And also another argument they have stated is that it puts unnecessary pressure towards the patients. To be honest, I don't see how it applies unnecessary pressure because they said that it applies unnecessary pressure from the family members. But if you ask me, or anyone else in this room, in this session, do you honestly think that any family member would like to see their loved ones die in front of them? Yes.
Okay. And that's what we say about palliative care. Are you saying that the system that we've been applying for years have failed? That you want to apply the euthanasia process?
Okay. Thank you. Let me continue first on my about palliative care. Okay, I'll address it later. Okay. So, and then they have stated about public backlash on euthanasia. Again, they have failed to provide any evidence on for what kind of public backlash. They have failed to give any evidence, and they have, and then another, and also the opposition. I believe they are pro palliative care, and I agree. I agree about palliative care, but I have no problems with palliative care. But again, I would like to remind this motion is to clarify on whether euthanasia should be should or should not be in a country or whatever, because we believe that there are more harm being done. Should euthanasia does not have any it's not be given as a choice towards the patient. And we have already stated that in our arguments why we supported euthanasia, which is the right to life. And also we would like to offer patients we would like them to have less suffering, and we don't want for them to suffer a lower quality of life. And also it is also to prevent suicide, which is, I believe, is more traumatic than assisted suicide. Therefore, we believe that without a shadow of the doubt, whatever the opposition have given today, we as with the government will stand proudly towards this motion to support euthanasia. Thank you.
Thank you so much. Let's move on to here.
Can you hear my voice? And can you see me?
Yep.
Okay. So, okay. Assalamualaikum. Very good evening, Abi, to everyone present here. There are three things that I'll be doing as a whip. Firstly, I will clarify the context of the debate and provide rebuttals. Secondly, I will compare both cases brought by both of the House and tell you why we opposition team understand this debate better. Thirdly, I will show the outcome of this debate and reaffirm our stand. As an opposition team, we firmly do not support this motion, which is this House support euthanasia, because euthanasia causes more harm than good. The context of this debate is to find the final decision in determining whether euthanasia should be supported. Does it actually give a huge positive effect to our community and country, or actually it give more harm? Hence, opposition team should give their reason on why actually they wanted to support euthanasia. Since they don't even understand actually what are the current status quo that actually make them support euthanasia. Ladies and gentlemen, from the beginning to the end, we can see how the government team have failed to understand our debate. Move on, I will state on how actually the government failed. The government case have no structure. Hence, the case are not well presented. Until the third government, only they mention about the procedure and criteria. Who is the Prime Minister today? However, it is not specific enough. Why? I say because they always mention the right to live, but what are the specific regulation and policy that they want to apply? Because who involved in the process is very important. Whether it is children or it is adults and the age. The government team also mentioned that they actually need consent, but actually they did not mention the children need parental consent. Even though that is a small thing, but that also need to be included in the policy, right? So who involved in the decision-making process actually? So all these small little things need to be considered in the policy. And also, who monitor the doctor? Actually, is there any council member or any division that
actually monitor the doctor to make the decision of euthanasia of a patient, or is there any specific procedure? No, it is not even mentioned that specific by the government team. Move on. I will move on to my points where we actually I will move on to the rebuttals where the government team keep mentioning about the right to live, the right to live. Yes, we know the right to live, but actually euthanasia is not the choice. We can have other choice like palliative care, like mentioned by our deputy leader of opposition, because palliative care actually incompatible with euthanasia. As mentioned, the World Health Organization, WHO, says that palliative care intends to neither accelerate nor postpone the death. 90% of the doctors working in the palliative care in Canada oppose euthanasia. So actually, that is not very clear when we compare euthanasia with palliative care. We have other option that we can do instead of ending a patient's life.
POI, please.
Although we have their consent. Yes, I received from POI.
Okay. Okay, I would like to remind you, because you've said you said that us the government are comparing between palliative care and euthanasia. But I would like to remind you that that's your point. That's your I believe
okay,
that's
what is your
one
question,
of your,
please?
Yeah. So why are you pinning this on us? We are, because I thought this is a debate about euthanasia,
okay,
and
thank
you are the
so
ones who are.
I think the government
palliative
did
care.
not even mentioning or any question. So I'll proceed with my point. Palliative care, actually, what we come out with palliative care, actually one of the choice actually not ending the patient's life. They have other choice that we can be done. Instead of supporting the euthanasia, palliative care that provided by well-trained team can actually able to control physical, psychological, social, spiritual. Like mentioned by the government team, actually euthanasia and the sickness, the pain that caused by the patient actually will bring up psychological issue. But actually palliative care can solve all these issues since it deals with care rather than cure. Actually, we can reassure that the general practitioner can reassure terminally and chronically ill patients that they are not a burden, that they need to the remaining of the life actually is worth living. So instead of supporting this euthanasia, actually we have other things that physicians should do, which is they should not abandon patient once they determine a cure is impossible, must respect patient autonomy, because actually euthanasia can influence the mindset of a patient, whether if they're sick and they need to make decision which lead them to unnecessary pressure. So this is very unethical, and this also will lead to the doctor have overpower on have a responsibility to actually making to end the patient life. So in conclusion, we as opposition team firmly do not support this motion because euthanasia causes more harm than good. Thank you. That's all from me.
Thank you so much. Third opposition. Let's go to reply speech from side opposition. Here.
Excuse me. May I have a question to the moderator? Shouldn't there any break session before the delivery of the reply speech?
Yeah, I don't think we have a break before reply speech. So we can proceed to opposition's reply.
Okay. Hello. Can you hear me?
Yep.
Okay, can you see me clearly?
Yep.
Okay. Ladies and gentlemen, representing my team for the last time, my speech will be divided into two levels, in which the first level I will address all the flaws coming from the government team, and on the second level I will show why the opposition case is better. Now, on the first level, we can see that a lot of flaws coming from their side. First of all, the government never shows that if they want to apply this euthanasia, they never show the proper policy that how they are going to actually characterize this euthanasia. And you need to realize that when you are trying to adapt or adopt a policy from another country, just because the policy works in that country doesn't mean that it will actually work in our country. We need to ensure that there are so many proper considerations that we must take before we want to apply other policy in our country. And also, they never also mention any procedures in which as we all know, that euthanasia involve a lot of things, involve a lot of professionals, patients, and who are going to monitor the patients, who are actually involved in the decision-making process, and who are going to actually monitor these doctors that actually assist in the euthanasia. And also, the government never also failed to mention what is the problem with the current status quo, which is implying that they don't even know what is the current status quo problem until they want to actually apply euthanasia. They should have been mentioning that they should have been addressing the current problems with the policy that we have until they want to actually apply euthanasia. And also how the second minister stated about the expensive cost of medical treatments, which why they want to actually provide option by euthanasia is actually very, very dismissible. Because why? I've already stated that government provided a lot of incentive and financial supports for these people who are able to actually support the cost of the financial treatment itself. Thus, the case from the government today fails. And only coming from the third minister that only he mentions regarding the procedures, and also specifically saying that only adults will be applied euthanasia. But we believe that by that time it's actually too late. And also, coming from the case for the opposition team, our case is very, very simple. We believe that euthanasia should not be applied in our country because of a lot of harms that it causes. And also, we have also shown that actually we believe that by the initiative of palliative care is actually already sufficient in our country. First, our opposition leader already stated regarding the lack of regulations if euthanasia is trying to apply. In the current regulation and policy that we have, there should be actually specific consideration from the government team to actually shows the policy that they want to actually apply in the terms of euthanasia in actually Malaysia. And coming to our second point, we have already stated regarding the unnecessary pressure that is actually put to the family and the patient itself when euthanasia is actually given. And we have already shown to you that how it's actually included in the initiative of Ministry of Health, where they want to expand more the treatments of the palliative care in Malaysia. This is actually shows that palliative care is already sufficient in Malaysia compared to the euthanasia, which is what the government is trying to apply. Therefore, we believe that this case should be opposed because euthanasia causes more harm than good. And with that, I raise my case. Thank you.
Here. Now let's welcome the last speech of the day. Reply from side government. Here.
All right. There were a lot of fine lines to draw in this debate. Today, in my reply speech, I will summarize both of our sides' cases, and I will tell you the differences between our two cases. Let's cut to the chase. What exactly is it that the opposition today is trying to say? They say that this motion violates human rights. Ladies and gentlemen, we do not obligate euthanasia. We do not say, oh, that patient is terminally ill, we must proceed with euthanasia. No, this is not the case. What we said just now, if the patients are terminally ill, regardless children or adults, with the consent of patient or family members, we give them choice to either proceed with this method or not. And to say that this motion violates human rights is very wrong. Second one, they say that euthanasia does more harm than good, which clearly contradict with their first stand. And then he said, our second opposition said euthanasia will cause pressure to the patients. Again, I want to clarify that we do not force or making euthanasia compulsory. We give them choice. Clearly, they do not hear to our points. Lastly, they always argue about mechanism. Today, our motion today is either we support or oppose this motion. Unfortunately, they did not clarify on that matter. From our side, firstly, we tell you that we support this motion with several conditions. And our first argument, we discuss about how this terminally ill patient has the right to choose for between death or life full of suffering. We also tell you that if this dying patient suffer from that one, these dying patients are suffering from the disease, how their body system will start to fail to function properly, and they will be unable to do normal tasks. And we also discuss about how this motion will avoid suicide, because there are people who commit suicide because of their terminal ill. Last but not least, we, the government, support this motion. Thank you.
Thank you for the request from government side. Ladies and gentlemen, with that we have reached the end of the debate session. We hope you had an excellent time watching the great speakers, and we'd like to sincerely thank you for tuning in. However, participants are required to enter another room for the feedback and results. For the audience, the results will be announced soon, so stay tuned. Thank you.
Welcome back once again, everyone. It is nice to see everyone again. As much as I would like to commentate on the previous session, I believe everyone is enthusiastic about the last session of the day and cannot wait to anticipate the proceedings of the next session. So, I am not going to commentate and instead proceed straight to the motion. Now, allow me to introduce the motion for the last session of day one. Ladies and gentlemen, this House will ban non-essential cosmetic surgery. Ladies and gentlemen, we hope you enjoy the debate session. We will proceed on with the debate session in a short while. Thank you, everyone.
Can I know if all three debaters from side government are present in the room?
Yes, they are present.
All right. Is all three debaters from side opposition present?
Yes, we are here.
Is the adjudicator for this room present?
Present.
Ladies and gentlemen, good evening. I'm pleased to welcome you to the first preliminary round of the 7th MyPSA National Pharmacy Debate Competition 2021. This debate will now come to order. Representing the government side for today's round will be the team from Quest International University 2, and representing the opposition bench for today's debate will be the team from Taylor's 1. It will be my responsibility as moderator to remind a couple of things that each debater must keep in mind during this round. Number 1, sensitive issues that would be offensive to political, religious, or ethnicities are prohibited. Each debater has an allocated speech time of 5 minutes. The bell will be rung for the first time at the 1st minute and for the second time at the 4th minute to indicate POIs will no longer be accepted from opposing sides. Once 5 minutes have been reached, the bell will be rung twice to indicate that the allocated speech time has come to an end. The allocated speech time for reply speeches are 3 minutes, with no POIs from either side. With that, to kickstart this debate, I'd like to warmly welcome the Prime Minister to open up the case for the motion being debated today. This House would ban non-essential cosmetic surgery. Hear, hear.
A very good afternoon, Mr. Chairperson, honorable adjudicators, respected opposing team, members from the floor, and my loyal teammates. This is the Prime Minister of the House, and this House would ban non-essential cosmetic surgery. Before I put forward my case today, I would like to define today's motion. According to Longman's Dictionary of Contemporary English, non-essential means not absolutely necessary or optional. Ladies and gentlemen, it is optional. Next, I would like to define the term cosmetic surgery. It is a procedure to enhance or reshape parts of the body. Cosmetic surgery is different from critical or reconstructive surgery, which is a procedure that restores the body from an injury after a disease, or it corrects above effects. And in this way, it is actually not essential to life or health. Cosmetic procedures can be classified into surgical and non-surgical cosmetic procedures. However, as the government team, we would like to limit the model of this motion to surgical cosmetic procedures, which is a medical procedure involving an incision with instruments such as breast enhancement, which include breast implantation, facial contouring, rhinoplasty, and tummy tuck. In other words, we are not focusing on these non-surgical procedures such as Botox injections, which is also used for medical purposes such as treatment of neck spasm, excessive sweating, lazy eye syndrome, and many more that we will not be able to mention here. Now, ladies and gentlemen, I, as the first speaker of the government team, will be proposing an argument on an individual level about the high cost for surgical cosmetic procedures. Our second speaker will be taking on an individual and society level regarding the financial taxing on the patients and the cosmetic surgery providing superficial solution to patients. Lastly, our third speaker will rebut all points made by the negating and summarize the three arguments made in this House. Today, we, the government, strongly believes that this House would ban non-essential cosmetic surgery. Ladies and gentlemen, before I start with the elaboration of my point, I would like to stress on the point non-essential, which means patients are doing it mainly for their own wishful thinking to be prettier. However, they are not aware of the side effects that will come along just to fulfill their wishes. And we here believe that prevention is definitely better than cure. And surgeries itself, not to specify any types of surgeries, has their own risk, which may be detrimental. Ladies and gentlemen, now I would like to focus on my point on why I agree with the motion. With the motion is because the chances of cosmetic surgeries failures will lead to many negative consequences later on, which whether it will be psychological or physical. And not to mention about the high risk of the infection, which increases the chances of death just for vanity. Besides, there are also chances of cosmetic surgery failures. Take for example, like Michael Jackson, a famous singer who have undergone multiple plastic surgeries, which includes whittled down nose, lightened skin, a natural cleft in the chin, and many other more. And this has led him to suffer from multiple side effects from the cosmetic surgeries, which have led him to be taking a lot of medications for his post-side effects. And unfortunately, he passed away from the cardiac arrest caused by a fatal combination of drugs given to him by his personal doctor. And since it's not essential, is it worth the risk? Life is precious. Why are we putting the risk on death to people just because they want to be prettier? Yes, you may say that beauty belongs to the eye of the beholder, and people might be stressed up and disturbed. And worst case scenario, it might cause psychological disorder if they are not allowed to procure cosmetic surgeries just because they think they are not pretty enough. But how about after the cosmetic surgeries? There are also cases where people will criticize people who have undergone plastic surgeries to have thick beauty standards, and this will also eventually lead to psychological disorder, such as depression for those who are unable, to handle the criticism from the public. And that is why the main issue here is the side effects that come after, which is mainly not focused by most patients once they have decided to go for non-essential cosmetic surgeries. Therefore, as a conclusion, we as the government team strongly agree that this house would ban non-essential cosmetic surgery. Thank you. Now I would like to pass to the second speaker of the government team. Opposition team, sorry.
Thank you, Prime Minister, for your speech. Now, without further ado, I'd like to invite the Leader of Opposition to respond to the case brought up by side government. Here.
Just a quick check, am I audible?
Yes, you are.
Okay, so we'll start in 3, 2, 1. Good afternoon to the respected moderator, cautious timekeeper, honorable judges, member of the opposition team, and member of the floor. I'm Brian, the opposition leader. For the motion today, this house would ban non-essential cosmetic surgery, and as the opposition, we strongly believe that this motion shall not be implemented. So before I put my case forward today, I would like to agree with the definitions. Okay, the ban word, which is referred to forbid something officially. So you are telling the people no to non-essential cosmetic surgery. And I want to redefine the words non-essential cosmetic surgery. So for our side, this non-essential cosmetic surgery is surgery for personal benefits, for example, plastic surgery. So I will move on. Okay, today as the opposition leader, I will be talking about the main point regarding the social aspects, and our deputy opposition leader will be emphasizing on the benefits, mainly on the economic aspects. And our opposition whip will rebut on sum up our team case. Okay, so why we should retain this plastic surgery? Because we don't want to abolish human rights to increase or for pursuing their good appearance. According to the American Society of Plastic Surgery, almost 18 million people undergo surgical and minimally invasive cosmetic procedures in the United States in 2018. And then this total means that there were a quarter of millions more procedures in 2018 than in 2017. So cosmetic surgical procedures have been on the rise in the US over the past 5 years. And then our side think that there is no reason to ban this because the humans have the right to choose whether they want to undergo this surgery or in a direct way. We are actually, the government thing are actually prohibiting the people from pursuing beauty. Okay, and then for our house, we will not want to take away human rights from demanding good appearance, and we are providing them a choice for themselves in aspects of beauties or cosmetic purposes. And for our side, we actually set a lot of rules and regulations, and the patients must follow the standard operation operating procedures, and they have to know the correct procedure to do this before they take the risk, okay, for this non-essential surgical cosmetic surgery. So for example, the cigarettes package, you can see all the ruined lungs, the defected babies, right? So these the same things go to the non-essential cosmetic surgery. So our government can do that, or the doctors or the practitioners need to show the visualizations, okay, of this kind of pictures by if the people want to. Sorry, please. Okay, and then this non-essential cosmetic surgery are not illegal because it is ethical. There are medical practitioners are practicing on this kind of fields, and there are some of the doctors are specializing in this kind of fields, and the system has been established in a long way with a very mature manner. Yes, please.
Yeah, what you talk about the doctors were showing about the medical, pictures. What do you mean by that?
Yeah, so that means before the patients go for the non-essential cosmetic surgery, we need to let them know the side effects or the adverse effect or the bad consequences. Okay, hope I answered your questions. So I will proceed to my main point. So first and foremost, it can increase the self-confidence. So when you look good, you feel good. All right, and take the Korea as example. Why Korea is accepted as the country for cosmetic? Since they go for most of them go for that non-essential cosmetic surgery, especially the celebrities. And then the K-pop now is become popular, and this show the perceptions and the demand for the world for a better appearance. And second, I move on to the this can improve the physical health, whereas some plastic surgeries procedures can improve your physical health as well as your looks. For example, rhinoplasty or your nose reshaping surgery may improve breathing at the same time. And for those with a physical deformity, such as metonymy patients, children born with a cleft lip, or individual who are scared, scarring cosmetic surgery is really helpful. Okay, so it can also help the people who are not physically deformed but we have a problem with specific body parts by correcting their perceived flaws, or women who are suffering after breast cancer surgery. And to plastic surgeries can also be a restorative procedures where returning the body to its original state after accidents, injuries, or other events. And I need to emphasize that the government team, they ban. So that means that they prohibit or they forbid this non-essential cosmetic surgery from happening, right? So from my side, we strongly believe that banning is not the approach to tackle this kind of problem, because people who demand for the good appearance won't love themselves when you ban this kind of things, when you ban the non-essential cosmetic surgery. So that's all from me. Thank you.
Thank you for your speech. Now, let's welcome the Deputy Prime Minister to continue the case for their side. Hear, hear.
All right. Hello, good evening to everybody. I'm the Deputy Prime Minister of the government team, and I'm here to discuss about my point of view why, as a government, we should actually ban non-essential cosmetic surgery. But before I get to my point, there are two things I want to bring up from the opposition side, because the opposition side has correlated human rights with good appearances. I believe that human rights has to have more value by just good appearance alone, right? Do you believe that human rights should be just more than just plastic surgery? I believe human rights should encompass about the human's value, right? We're talking about how do we put food onto the table, how do we put roof over our heads? And I believe those are the real human rights, as we are all going to discuss right now, which is about the economy, right? And this is why I want to bring up 2 points. Okay, cosmetic surgery, non-essential cosmetic surgery is a very expensive procedure. It is very financial taxing on the patient's behalf in terms of cash. And second point is that plastic surgery only provides superficial solution. Okay, by going on with the opposition side, it only implies that plastic surgery is only meant to treat patients who are unhappy with their appearances. Okay, and so this is where I want to put the keyword, which is the word unhappy. Okay? And I believe that psychological care is a way more sufficient approach to that unhappiness, and of course, a cheaper alternative for individuals who are insecure. I believe that in our society today, we are having a priority disputes. We have kind of messed it all up. How come that people have no qualms in paying $100,000 for a liposuction or a breast augmentation procedures, but they are not happy in paying $100 when comes for a therapy's treatment, discussing about their problems? Why is that? And ironically enough, people do not make heroes out of regular doctors, nurses, and pharmacists, but they only make heroes out of people who are rich and famous. All right. So pay $100,000 for something so insignificant only seeks to challenge the front that patients are only just a cash cow and not a patient. And furthermore, if you take an example of our economy situation about the COVID-19 situation, as well as the Evergrande financial breakdown. Due to the collapse of the Evergrande breakdown, the real estate company in China, the share prices in the stock market, in the global market, is being affected as well. This also reminds me of a 2008 housing bubble crisis, where millions, if not billions of people have lost their home as a result. Hence, in my view, the cosmetic surgery only seeks to deplete the patient's safety net for long-term financial securities in exchange for a short-term joy of happiness over their looks and appearances. And go to my second point, is that plastic surgery only provides superficial solutions. Here I see there's a big problem in our healthcare situation today. People will only look for easy solutions for complicated problems. Plastic surgery only helps to treat the symptom of the problem, but not the root cause, okay? And the root cause is that they are very unhappy of who they are. Take, for example, Ollie London, who spends approximately $150,000 in multiple cosmetic surgery just to look like a Korean pop star. Yes?
Ananita, you can go ahead.
Oh, okay. So are you saying by banning cosmetic surgery, you're going to fix the root of the problem, which is basically self-love? Are you saying that?
No, but this is what I'm going to bring to my next point, right? He spends around $150,000 to look like a Korean pop star, Jimin, all right? Who is, by the way, a member of BTS, all right? He is so unhappy with himself that he spends so much money to look like a person, look like a Jimin, and he publicly declared himself that he's a Korean descendant, even though he is biologically an Englishman who is born and raised in the United Kingdom. Based on the story above from the opposition, if you're giving me the question, do you feel Ollie London able to achieve happiness by loving himself through somebody else's image through plastic surgery? The short answer is no. Like any other individual, like you and me included, people have their own issues and insecurities that cause depressions. But I believe those issues, the person's appearance should not be one of them, okay? Therefore, by banning non-essential cosmetic plastic surgery, we only encourage the patients. We only encourage the patient. We're not punishing them so that they can look for more apparent solutions through their insecurities and sadness so that they're able to achieve true happiness. And that's all for today. Thank you.
Thank you, Deputy Prime Minister. Next, I'd like to call upon the Deputy Leader of Opposition to present their speech. Here.
Can I confirm, is my sound audible?
Yes, you're audible.
Okay, so good morning, good afternoon to Mr. Moderator and Judge and members from the government side. As the second speaker, I'm here to confirm some of the similarities about two sides for the motions. So we think that the non-essential part is not in a health purpose, but for the cosmetic purpose only. So just for the Botox, if the person are doing not for the health purpose, it could also be considered as a non-essential cosmetic surgery too. But I have a question here. Does your banning really stop one desire to do the cosmetic surgery? So I'm here to continue the speech from the opposition leader. So at first, we think that if you are really banning this, you can't really make these things to completely stop. So they would just find alternative ways to be illegal. So as we know that when we ban these things to be happen, there's no more guidelines and operating procedures are going to implement. There are no needs in implementing these non-essential cosmetic surgeries in the country. So what's the negative consequences we we might have to face. First, the government shall aware if you are banning this, you cannot stop the desire of the person. They might go for the illegal way as there are no licensing for the medical practitioner to do this. It might cause some of the unprofessional doctors who go for the surgery, which decrease the success rate for the surgery. So if these things are not be banned, there are no guidelines, then what should you do? For the second part, the person cannot also get their proper aftercare. So if you implement these kind of things, we ban this motion not to be approved. The person who has done this surgery, at first, if the things is not banned, it can go for some aftercare if there's any problem. However, if this motion is implemented and they go for the illegal way, so they are scared about the punishment. So once they do this surgery, it can't really decrease one desire, but cause more consequence problems that are not being faced by the government. So I'm here to say that if you want to really get this motion to be done, you need to overcome this kind of problem. So for the second point, in the economical issue, it might give some bad economic impact towards the country. Why would this could be said? Because as we know that this kind of non-essential surgery are actually ongoing. It's quite legal, as mentioned by the opposition leader. They have a good system with a long history. So as we know that a lot of practitioners, they want to earn more money. They go for this way. They go for this specialization. They spend 4 to 5 years for learning this kind of things. And then you suddenly say that, oh, this one need to be banned. So what they do, they might lose their job, and then they will just wasting time on doing this kind of things. I'm not saying that the person who will completely lost their job because of this non-essential cosmetic surgery. But as we say that they are big proportion of the non-essential cosmetic surgery compared to the essential cosmetic surgery. So as these kind of things will just compact to the country, as the country didn't have the tax to have not the income in the source of tax. So as the person who want to do it illegally or want to do it at another country, which the country didn't ban this kind of surgeries, then the government will just lose this kind of income of the money. Okay. So after I continue with my rebuts for the speakers. At first, the second speaker say about is actually quite expensive. Actually, we are aware that these kind of surgery are actually expensive. But why there are so many people who wants to insist to do it? Because they think that their appearance is not that good, and then this might be very severely affecting their confidence and also their social needs. If let's say I go for the social gathering, people are laughing me at my appearance. So this is one of the choice we can let them to do this, but they need to take their risk and take their consent to make sure these things could be go for this motion. And also they say that there are some this motion, if they are not banning, they are just overcome some superficious problem only. But I could say that it actually is an urgent problem, because some of the people, if they are really in a low confidential status, they will just go for some negative social aspects thing, such as some suicide rate. So these kind of things that we cannot be we cannot just ban this choice as this kind of negative consequences are going.
Thank you for your speech. Now, we would like to invite the government whip to respond to the opposition case. Hear.
Am I audible, Mr. Moderator?
Yes, you are.
Okay. Thank you, our respected moderator. A very good evening. I would like to wish to everyone present here today on this lovely day. The motion being debated today is the House would ban non-essential cosmetic surgery, and we, the government, agree with the motion. I, as the third speaker, will rebut all of the points from the opposition, and I will do this before coming to my own arguments. Let us first have a look at what the opposition leader has mentioned. The opposition leader has mentioned that they would like to disagree with the motion being debated today based on the fact of human rights. First of all, ladies and gentlemen, human rights is very subjective. We, the government, are not opposing human rights. Human rights is extremely necessary. However, there are rules enacted under Acts under our national constitution for a reason. The decision to banning non-essential cosmetic surgeries should not be made blatantly on the grounds of human rights alone. However, the decision should be made based on facts after weighing the pros and cons of banning non-elective cosmetic surgeries. My opposition leader and second opposition speaker has clearly mentioned the reasons to support banning of these type of non-essential cosmetic surgeries, which has been stated by the Prime Minister in a definition. Other than this, the opposition leader has mentioned that restorative surgeries are beneficial, and it is also one of the reasons non-essential surgeries should not be banned. Well, ladies and gentlemen, my Prime Minister has clearly mentioned that restorative surgeries are considered as an essential cosmetic surgery, and it is not to be banned. So there is no line to mention that over here that we are not supporting restorative surgeries because this is considered as an essential cosmetic surgery. Now, let's look at the points mentioned by the second opposition speaker. The second opposition speaker has mentioned the growth of illegal modes for non-essential cosmetic surgeries if, let's say, non-essential cosmetic surgeries are banned. The question is on the magnitude of these illegal activities where people would approach illegal methods to procure these non-essential cosmetic surgeries. Well, we, the government, would like to state here that once a rule has been enacted under the law, such as banning all these type of non-essential cosmetic surgeries, enforcement will be done by the respective ministries under this. And these type of illegal modes of getting non-essential cosmetic surgeries would be curbed definitely, as how illegal sales of cigarettes and alcohols are even being enforced at the moment by the government. We, the government, will try our best to stop this from occurring. And for medical practitioners, they have to be registered. And as people, we should be aware of obtaining these type of services from licensed medical practitioners. And these issues of illegal modes of getting these non-essential cosmetic surgeries, it may occur, but then what is the magnitude of this? We have to look at the bigger picture here, the community, the people. We would like to stop the exposure of them getting official modes of these type of non-essential cosmetic surgeries based on the reasons which has been mentioned by my Prime Minister and the Deputy Prime Minister in their first, second and third point from our government. We would like to stop the official methods so that the exposure would be minimal compared to these growth of illegal markets and so on. The enforcement would take care of this, definitely. And next, let's look into the economic impact as mentioned by the second opposition speaker previously. Well, the economic impact is very subjective. Yes, of course, taxes are charged on these type of non-essential cosmetic surgeries, and it is beneficial for the government. However, we would like to focus on the benefit of the people here. Firstly, the health of people is important. Based on the Hippocrates oath taken by the medical practitioner, health of people comes on top of the economic impact or the economic benefit which is being obtained from these type of non-essential cosmetic surgeries. Well, this is all of my rebuttal for the points from opposition leader and also deputy opposition leader. Now, let's look into the first point from us, the government, which is the risks of failure in non-essential cosmetic surgery, which is why we would like to state that these type of non-essential surgeries should be banned. And the second point from us, which is financial burden on patient. When others are able to obtain these type of procedures, those who feel less than them because they do not have the financial capability to obtain this type of non-essential cosmetic surgeries would feel burdened, and this may lead to all those unnecessary financial obligations with loan sharks and so on to obtain these type of services just to make them look much more prettier. And the third point from us, the government, which is non-essential cosmetic surgeries are superficial solutions that are not necessary. Well, based on these 3 points, we would like to sum that we, the government, stand in this debate that we believe the motion being debated today is absolutely true, and we propose the House to agree the motion being debated today. Thank you all for your attention.
Thank you, Government Whip, for your speech. Now we would like to invite the Opposition Whip to present their speech. Here.
Hello, am I audible?
Yes, you are.
Right. So a very good evening to the Honorable Adjudicator, esteemed timekeeper, members of the government team, and my fellow teammates. So the motion for today's debate is this House would ban cosmetic surgery, and we as the opposition team strongly and wholeheartedly disagree with this motion. So I'll first start off by rebutting the third speaker of the government team. So his rebuttal for our first point was that human rights is very subjective, and then banning cosmetic surgery shouldn't be based on human rights, and then it should be based on facts and pros and cons. So I would like to say that in any treatment, no matter what we do, there are pros and cons. And we as the opposition team, we are not disagreeing with that. However, we are saying that banning cosmetic surgery is not the way to go about this problem. Instead, stricter regulations and guidelines should be made in terms of letting the patients know exactly what the worst case scenario would be if they were to take this procedure, if they were to take it. That means at the end of the day, the choice is theirs. But they need to know every single one of these risks, whether it would be visually, clinically described, everything they need to know from top to bottom. That's how we plan on going about this problem. Okay, so the next rebuttal that he mentioned for our point, our second point is that we mentioned how by banning this cosmetic surgery, more illegal forms of cosmetic surgeries will arise. However, he's very confident that the enforcement of laws would handle this problem, and then the magnitude of this problem is not as severe. And banning cosmetic surgery is more important than anything. So basically, if there's anything to be learned from the past on banning things, it should be aware that people will find ways to get what they want. So think about the prohibition of alcohol. The entire process caused an uproar in the public, and people did not stop drinking. They simply found ways to sneak around and do it anyway. So we as the opposition team think that this illegal form of cosmetic surgery will bring about more detrimental effects. Yes, please.
How is human rights a benefit of non-essential cosmetic surgeries?
Okay, so I will come to that later. Basically, human rights is allowing people to have the choice to have a better quality of life. That's what we as the opposition team think. So if their idea of having a better quality of life is improving their appearance, which will improve their confidence and self-esteem, then yes, it is a form of human rights, and it is their choice. It should be their choice at the end of the day. No, thank you. So yeah, basically, I would like to say that more detrimental effects will come about if we were to ban cosmetic surgeries, because more illegal forms of this procedure will arise. And right now, at least we have the form of aftercare in case something does go wrong. They can go seek medical attention in case the procedure does go wrong. However, if you were to ban cosmetic surgery, and let's say they go to an illegal form of cosmetic surgery, if it does go wrong, they would be too afraid to seek any form of medical attention because it's illegal for them to even carry out cosmetic surgery. So instead of seeking medical attention, they would rather suffer in silence with their bad side effect. No, thank you, sorry. And that would definitely increase more fatality rates due to cosmetic surgery. So you're not actually helping the problem, you're actually causing more problems by banning cosmetic surgery. So his third argument was that the health of people is more important than the economic growth. And we as the opposition team, we wouldn't like to choose or put one over the other because they both correlate to each other. If we are able to contribute to the economic growth, we will definitely help contribute to the healthcare system as well of our country. So in both ways, we are helping contribute to the health and the economic growth of the country. No, thank you, sorry. Next, the second speaker, I'll go on to rebutting the second speaker's points, where he mentioned that human rights should not be solely based on the appearance. So I believe that human rights, like I mentioned earlier, should be a choice given to people, whether it's to improve their quality of life. And statistics have shown that people's lives, quality of lives, whether it's mental, physical, social well-being, have improved due to cosmetic surgery. And this is definitely something that should be a choice, and we shouldn't ban it completely. His second point was that it's very expensive. it's a very expensive procedure and people would rather pay for this rather than going for therapy. So I believe that the quality of the procedure is definitely very important. So if we can ensure that the quality of the procedure is good, is established, and people will have the lowest risk of side effects or negative consequences, then yes, it should be expensive, and only people who agree to carry it out should afford it. So at the end of the day, it really has to be the person's choice. We cannot decide for them what is right and what is wrong. So about the therapy, I believe that people know what's best for them. And if carrying out this surgery is what's going to help them the most, then so be it. Yes, so we as the opposition team truly believe that banning cosmetic surgery is not the way to go about this problem, and instead, other approaches should be carried out instead. Thank you.
Thank you. That concludes the substantive part of this debate. Now teams will have 1 minute to prepare for the reply speeches. The 1 minute allocated time is up. Now, I'd like to invite the reply speaker from side opposition to present their speech. Here.
Hi, am my sound audible?
Yes, you are.
Okay, good afternoon. Here comes to my reply speech, and I would comment that today's match is quite clear. Both sides also provide their points, and then let's see what's the main point the government and the opposition give, and then why our side is in benefit. First one, the government, they made a main point, which is the side effects, and then our point is just made by the human rights. Why we say that the side effects are actually not an issue to be concerned. The first one, because the technology is quite improving, and also if you're just improving this technology and we take the technology from the other countries and then we learn together, and these side effects could be decreases drastically. The second one, because the person who want to do this surgery have the consent to do it. We actually are not forcing them to do it. They have their consent. They must know the risk of doing this management, and then if they fail, they cannot blame for the authorities. So that's the point. Okay. And then let's see for our side. Our side mainly talks about the human rights. Actually, human rights is not that the opposition side, the government side says that if you really don't need to do it, if you do some small action, it actually didn't affect at all. Actually, it could also be caused by some small action because the person have the needs already. The needs is quite urgent, and then you don't want to let these things to be happen. So, as the human rights, people should have the choice to have the option to have the better quality of life. And then this procedure is quite legal. And then what's the point you want to ban it? And also, let's see the government's second point. Second point, they just talk about the economic issue. Actually, if you talk this for this economic issue, it can't stop the person from doing the wrong thing. And also, the person will just do for go for an illegal way, and maybe the cost might be more expensive as it is banned and it's more procedure needs to go. So in this pathway, we can say that our opposition side is more beneficial, and we cannot let this motion to do it. Thank you. Okay. We have sorry, I have 45 seconds left. So we can see that if the things is quite legal and it is quite ethics, there's no need to make this illegal pathway to be happen if you do not to ban this, if you do not ban this motion. And we can see that as the negative feedback the negative consequences that I just mentioned earlier is not going to happen. So these things shall be approved and not be banned. So that's all from me. Thank you.
Thank you. And now, to conclude today's debate, I'd like to invite the reply speaker from side government. Here.
Thank you very much from the juries and judge. Hello, ladies and gentlemen, and good evening. Now it's time to wrap up our debate. Before I introduce some of our main clashes of today, I'd like to summarize our cases presented by my teammates from the government side. And I would like to re-emphasize on this point that the cosmetic surgery is a procedure that enhances and reshapes the part of the body. Okay, and the cosmetic surgery, it is very, very different when you come to compare to critical or reconstructed surgery that helps to improve patients' looks who has got through like multiple chemical burns or physical burns that is, help them to live in a normal life, right? And cosmetic surgery is not that sort of procedure. As a matter of fact, it's not a matter of an essential to life and health. It's just a matter of looks. So why are we going on with this debate between what are the merits of cosmetic surgery where it itself has provided zero health benefits? Okay, so before that, I would like to start our first point, which is brought up by our government leader, is that her point is that the chances of cosmetic surgery failures and side effects after cosmetic surgery is too high to handle. This is where we at the government approve this point because we do not want to cause more harm to our patients, as we all in this debate team has carried a Hippocratic oath to not to cause any harm to the patients, right? But of course, looking towards a health perspective, I don't think we're doing a good do our due diligence and responsibility to our patients, because we also forgot about the main issue that is moved beyond the health-wise, which is, first of all, their mental health, and secondly, their financial problem, okay? And have brought up a lot of example of why cosmetic surgery, which is non-essential, is very, very expensive for any patients to handle. And most importantly, the plastic surgery has not provided any conclusive facts or evidence to prove that it helps patients to be more happy and be self-confident, which has been felt to be given by the opposition as evidence. Hence, to summarize of all the cases I've given to you, and we have weighed between the risk and the benefits of non-essential plastic surgery, which is that we are doing it because we're not here to punish our patients, but just to give them an alternative routes to help looking for a more apparent solutions. All right. Yet our opposition have failed to address those 2 points, which is, when do they discuss about the financial issue of the patients? We have never heard about that. And secondly, they have not discussed between the happiness of the patient after they got the cosmetic surgery. All right. So let us talk about our main and most important clash in this debate today, which is the question of the mental health of the patient. So therefore, I would like to say that as a government side, we feel that the cosmetic surgery only serves to be creating this self-destructive behavior among the patients and not looking for easy solutions, rather than using more apparent solutions to help taking care of their mental health. Thank you very much.
Ladies and gentlemen, with that, we have reached the end of this debate session. We hope you had an excellent time watching the speakers, and we'd like to sincerely thank you for tuning in with us today. The results as well as the feedback will be announced shortly, so stay tuned. Thank you all.
Welcome back, ladies and gentlemen. We have reached the end of all the debate sessions for today. Thank you everyone for your presence. Now we are going to have a 3-hour break for dinner, but before that, my partner here has something to say.
Before you take your leave, please be reminded that we will have an online webinar at 8 p.m. later. Do join us if you are free. Thank you.